I'd like to talk about your book, The Standard Care of Multiple Sclerosis. A patient has come to you with the diagnosis. What would be covered in your consultation to the patient on this subject?
So we're not diagnosing multiple sclerosis. We see people who already have a diagnosis, and we want to know what type of MS they have, how long they've had it, some things like age. So MS typically comes on in the 20s, in people in their 20s. And there's really two major kinds. There's one called relapsing, remitting, that kind of comes and goes, and one called progressive, which gets progressively worse. And we see both types. And in both cases, these are autoimmune diseases, meaning it's your body's antibodies attacking your parts of your brain. And the mechanism is called idiopathic, means like the word idio, like idiopathic disease. We don't know the cause of it. We do know it's autoimmune, it's immunomodulated. In this case, we're going to see what kind of drugs they've been put on. If you look at multiple sclerosis, it is actually one of the most expensive diseases to have, second behind heart failure. And this is because the drugs are very expensive and they just don't work really well. So people have sought out alternatives to conventional therapy. Now, then these are not to replace conventional therapy. The things I'm talking about are adjuvant of, or they're addition to conventional therapy, because still conventional therapy is needed. And if we look at the role of stem cells in MS, the stem cells for your body appear to be immunomodulatory, meaning they modulate the immune response. In many cases, can put people in some form of remission for about 9 months to perhaps a year. For pretty much any autoimmune disease, this has been shown in the laboratory and clinical studies, but for MS, about 9 months to a year. So what else can we do in addition to that to maybe get a longer term response? Well, in the book, I talk about a few of the things we've discovered with MS over the last 10 years or so. I wrote the book in 2018, so there's more information since then. But one thing was back in about 2014 or so, they were studying an antibiotic called Minocycline. Minocycline is commonly used for acne. It's a antibiotic, one of the few that penetrates into the brain. Interesting. And it's one of the few antibiotics that improves the microbiome of the gastrointestinal tract. So most in your gastrointestinal tract, or your bowel, you've got multiple bacteria, and most antibiotics are like dropping a time bomb in there, and this really messes that up, where minocycline seems to improve the diversity and richness, which are the two key components to a healthy gut. And we know there's a clear link between the gut bacteria makeup and MS. Now, we haven't been able to figure out how to exactly fix that, but there was a link discovered about 10 or 15 years ago that we can take the stool, the feces, from a person with MS and give it to a mouse and plant it in their gut, and the mouse gets MS. Okay, so this has been understood. We don't know what are the bacterial pathogens that seem to be causing that. Well, in Canada, there was a lot of research going on. And one of the things that they kind of stumbled upon was that in the brains that were autopsied, these are people that had passed away, they took the lesions, and the MS, they have these plaques in their brain. They took them out and they found DNA of bacteria in the lesions in their brain. The other thing that we see is there's an impaired blood-brain barrier. In other words, a block between the blood and the brain. We have a blood-brain barrier to keep stuff from getting into our brain, other things we might want. And that barrier is impaired in MS patients. And they also have impaired gastrointestinal or bowel-blood barrier. So they've got leaky gut, so quote-unquote leaky gut. What we're seeing is that there appears to be certain pathogens in the gut that create a leaky gut, allow bacteria to penetrate into the bloodstream, maybe different bacteria that potentially get into the brain. So that's been a working theory for some years. And they were using minocycline to treat MS, and lo and behold, the drug worked very good. It worked actually similar to these drugs that cost $50,000, $60,000 a year. Never really caught on because it's a generic drug and it's very inexpensive. And interestingly, that the research in Canada, which is really the leader of research, they kind of stopped it in 2014 because they got funding to do other stuff. So we just don't know. But this appears to be part of the scheme, is that perhaps using minocycline to improve the gut lining, the gut barrier, may improve. And also there's some penetration into the brain, and minocycline is anti-inflammatory. So we're looking at using minocycline for these patients a course of about 6 months. The other thing we notice is that men with MS have low testosterone, and women with MS have low testosterone. They respond well to an estrogen called estriol, which is a pregnancy estrogen. So when women have MS and they go in pregnancy, they typically go into remission. And it appears to be related to estriol, which is a very weak estrogen, this one that gives your skin the glow. So our current pathway is improving the gut microbiome by using certain what's called prebiotics, different than probiotics. Prebiotics are certain fibers. We use something called galacto-oligosaccharide, and we use something called beta-thylakoids. So these two prebiotics, minocycline to increase the bacterial plume, estriol in women, and testosterone in men and women, in addition to fat-derived stem cells, or something called SVF, stromal vascular fraction. I don't know that we could say the same for using some other type of stem cell like bone marrow or umbilical stem cells. Most of the studies have been done with fat-derived stem cells. And clinically, we do see improvement. We have never seen somebody get total reversal of their MS. We do see people who are progressive sort of slow down their progression and maybe go backwards a little bit. There's a point where the axons in the brain, little connections of the extension cords actually get transected in MS, and those are probably not going to grow back. But we could get the disability to stop and maybe reverse a little bit, or in relapsing remitting, get those relapses to be less frequent. So none of these are FDA indicated for the treatment of MS. MS remains a disease that has very little super successful treatment. So these are things you might consider, again, for adjuvant, things to do in addition to conventional therapy if it's not working for you, because this is a very debilitating disease. It's personal to me because my grandmother and my aunt died of MS. It was interesting, they lived in the same house. My grandmother died of MS and she passed away, and my aunt didn't get MS until she moved in my grandmother's house and she was in her 50s, which is unusual to get at that age. And there's been questions about the link maybe to, she was in a farming community, there was chemicals used, who knows? I'm not making any conspiracy theories on that. I just observed that this odd pattern in my own family, and it's made me always interested in MS and looking for things to potentially slow down this devastating disease, or in some cases stop it or reverse it.